Zinc is one of the most crucial minerals for your health, but if you're taking it the wrong way, you could be doing more harm than good. Many seniors make mistakes with zinc without even realizing it, and those mistakes can quietly affect your immunity, healing, and overall body repair. Quick disclaimer: this video is for educational purposes only and is not a substitute for medical advice. Today, we're breaking down the 4 biggest zinc mistakes seniors over 60 make, starting with mistake number 4. Stay until the end, because mistake number 1 is the most overlooked, and it surprises almost everyone. Before we get started, tell us your age and where you're watching from in the comments. Mistake number 4, taking zinc alone without supporting nutrients. Many older adults start taking zinc regularly, expecting to feel stronger or get sick less often. Weeks pass, sometimes months, and nothing seems to change. Naturally, some conclude that zinc just doesn't work, but in many cases, the problem isn't zinc itself. It's that zinc is being taken without the nutrients it depends on. Our bodies don't use nutrients in isolation. Every mineral and vitamin works as part of a larger system, and zinc relies on other nutrients to function properly. Magnesium, for example, supports hundreds of reactions in the body, including immune response, muscle function, nerve signaling, and energy production. As we age, magnesium intake and absorption tend to decline, which can limit zinc's benefits. Vitamin B6 is another key player. It helps magnesium enter cells and allows both magnesium and zinc to participate in processes that regulate inflammation, brain function, and immune signaling. Folate also plays a crucial role by supporting DNA repair, red blood cell production, and immune cell turnover. When folate is low, which is common in older adults, zinc's impact on healing and renewal is reduced. This is supported by research. In 2020, a double-blind randomized trial at Oregon State University followed healthy adults aged 55 to 75 who took a daily multivitamin and mineral supplement containing zinc, vitamin B6, folate, vitamin C, and other key nutrients for 12 weeks. The supplement group had the same likelihood of getting sick as the placebo group, but among those who did get sick, they reported shorter and milder illness symptoms, on average, fewer than 3 days sick compared to more than 6 days in the placebo group. Interestingly, many lab-based immune markers didn't change significantly. This suggests that zinc and these supporting nutrients may work together to reduce the severity and duration of illness, even if they don't prevent it entirely or show up in every immune test. Mistake number 3, getting too little zinc. Many people think the biggest risk with zinc is taking too much. In reality, for adults over 60, the bigger danger is quietly not getting enough. Low zinc doesn't always show obvious signs at first, which makes it tricky. Even people who eat a balanced diet can slowly lose zinc over time. Factors like chronic diarrhea, regular alcohol use, high stress, diabetes, elevated blood sugar, and certain medications can reduce zinc or make it harder to absorb. Hormonal changes as we age, including shifts in estrogen, can also increase the body's need for zinc. Another important point: zinc is constantly being used for repair and recovery. The more active you are, the more zinc your body needs. Muscle repair, connective tissue healing, and immune recovery all rely on adequate zinc levels. Seniors who exercise or try to maintain muscle mass may actually need more zinc, not less. Zinc isn't just about preventing colds. It's crucial for wound healing, tissue repair, and gut health. Forms like zinc carnosine may help support stubborn wounds, such as gastric ulcers or pressure ulcers, that may be more common in older adults. A clinical study at Tufts University found that low zinc levels are relatively common among adults aged 65 and older, particularly those living in nursing homes, with many showing moderate to very deficient serum zinc at baseline. This highlights just how common this quiet deficiency can be in older adults, even in the United States. To help prevent deficiency, prioritize zinc-rich foods such as oysters, red meat, liver, shrimp, and crab, which are absorbed more efficiently than plant sources. If you supplement, forms like zinc glycinate are gentle on the stomach and well absorbed. Even small, consistent improvements in diet or supplementation can make a meaningful difference over time. Mistake number 2, not recognizing the early warning signs of low zinc. Most people never have a dramatic zinc deficiency moment, There's no sudden crash or obvious symptom that points directly to zinc. Instead, changes appear slowly, over months or even years. Because they develop gradually, many seniors assume these changes are just part of getting older, rather than signs that something is missing. It often starts with small, easy-to-ignore changes. Experts at the Cleveland Clinic note that brittle nails, white spots, and ridges are often the first visible signs of low zinc in older adults, creeping in so gradually because the body's ability to absorb this mineral quietly declines over the years that most people simply blame old age. Hair may thin, break more easily, or shed more than usual. Minor cuts, scrapes, or skin irritations may take longer to heal. None of these feel serious alone, which is why they are easy to dismiss. Research from St. John's University in New York shows that low zinc often dulls taste and smell in older adults. Foods that once tasted rich may begin to taste bland, and scents may seem weaker. In people who were low in zinc, restoring zinc through diet or supplements helped improve these senses in many cases, making meals more enjoyable and supporting better nutrition. Zinc also plays a role in hormone balance and energy regulation. For men, it contributes to testosterone production, and low zinc can be one factor leading to fatigue, muscle loss, or decreased libido, changes often attributed solely to age. For women, low zinc may contribute to frequent infections, slower wound healing, lingering fatigue, and increased inflammation. Because these symptoms develop gradually, they are rarely linked to zinc deficiency directly. Some practitioners use a simple screening called the zinc taste test. A small amount of liquid zinc is swished in the mouth without swallowing. A strong metallic taste usually suggests adequate zinc, while little or no taste may indicate lower zinc levels. This test isn't a diagnosis, but can be a helpful signal that zinc deserves closer attention, especially when multiple symptoms are present. Timing matters too. Zinc is generally best taken with meals to reduce stomach upset. Avoid taking zinc at the same time as high-dose iron or calcium supplements because they compete for absorption and can reduce zinc's effectiveness. Mistake number 1, taking too much zinc. This mistake surprises many seniors because it's the opposite of what they expect. Zinc is often talked about as a nutrient most of us don't get enough of, so it seems logical to think that more zinc always means more benefits. Zinc and copper compete for absorption in the digestive system. When zinc intake stays high over time, copper absorption drops. There are usually no immediate symptoms, which is why this can go unnoticed for months. As copper levels slowly decline, important body systems are affected. Copper is essential for nerve health, red blood cell production, energy, and heart function. Low copper can lead to fatigue, weakness, anemia, balance problems, or cognitive changes, symptoms often mistaken for normal aging. While zinc supports immunity in the short term, long-term high doses can disrupt immune balance. Instead of strengthening defenses, too much zinc can increase inflammation or reduce immune responsiveness, which is especially concerning for seniors whose immune systems are already changing with age. In a case report by Campbell University researcher Nithin Gupta, a 76-year-old woman developed dangerously low copper levels after taking 50 milligrams of zinc daily for nearly a year. Her copper deficiency caused fatigue, anemia, unsteadiness, and tingling in her hands and feet, symptoms often dismissed as normal aging. Her copper levels were dangerously low. She stopped the high-dose zinc and took a small amount of copper daily. Within a few months, her energy improved, her blood counts returned to normal, and she was walking steadily again. Correcting the copper deficiency resolved the issues caused by excessive zinc. For ongoing supplementation, zinc should be balanced with copper, usually at about a 10-to-1 ratio. For example, 30 milligrams of zinc pairs with roughly 3 milligrams of copper. Higher doses should only be used short-term and under medical guidance. Zinc from food is rarely a concern. The risk almost always comes from long-term, high-dose supplements taken without balance. Once zinc intake is corrected, many seniors notice better energy, steadier immunity, and improved recovery without creating new deficiencies. But before you make any changes, talk with your healthcare provider to make sure it's appropriate for you. Once you've got the green light, informed choices can protect your health over time. If you want better sleep, calmer nerves, and stronger muscles, click the next video now to see what 30 days of magnesium glycinate can really do for your body and subscribe to stay informed and support your health every day.